Good everyone, welcome back to our channel. Thank you for following this video series. We do hope that you've learned one or two things from our previous video. Essentially, our videos on introduction to diabetes mellitus, our video on type 1 diabetes mellitus. So today, we want to talk about type 2 diabetes mellitus. Just like I've explained when we were doing the introduction to diabetes, I said it is the disease of the endocrine gland, which is common, and it usually leads to the persistent increase in the blood sugar level. And we were able to establish the fact that in the case of type 1 diabetes mellitus, insulin level is very low, or it might be insufficient, or at the same time it might be totally absent. And that is because there may be autoimmune disorder which may cause loss of the beta cells of the pancreas islets, which is responsible for the production of insulin. So let's look at type 2 diabetes and see what will happen into the level of insulin. And don't forget that according to World Health Organization, diabetes mellitus is categorized or classified into 6 categories, in which type 2 diabetes mellitus is one of them. And the type 2 diabetes mellitus is responsible for about 90 to 95% of all the diabetes cases that are reported. Unlike in type 1 diabetes mellitus, which occurs in children usually less than age of 20, in teen individual, or someone who has normal body weight, type 2 diabetes mellitus usually occur in adults, and usually it occurs in obese individual. So this is where we are linking our video on body mass index, obesity, to hypertension and also diabetes. So someone who is obese is having likelihood of developing hypertension, and at the same time the person is having likelihood of developing diabetes. And what is definition of that obesity? It is when the body mass index of an individual is equal to or greater than 30 kilogram per meter square. So for type 2 diabetes mellitus, anyone who is obese is predisposed to having this disease. Unlike in type 1 diabetes mellitus, where ketoacidosis occur, in type 2 diabetes mellitus, ketoacidosis is rare, and also autoimmune is absent, unlike in type 1 where there is autoimmune disorder. In type 2 there is no autoimmune disorder, and we say ketoacidosis is rare. The concentration of insulin might be low, it might be normal, and it might be more than the normal in case of type 2 diabetes mellitus. A type 2 diabetes mellitus usually occur approximately in 6% of men and approximately 5% of women, which means males are more prone to developing type 2 diabetes mellitus more than female. So the factors responsible for the development of type 2 diabetes mellitus are basically lifestyle and genetics. And this includes obesity, which I've mentioned earlier. So when one's body mass index is equal to or greater than 30 kilogram per meter square, so such person is prone to developing obesity. When one lacks physical activity, when one do not do exercise regularly, poor diet, urbanization, poor diet, and dietary that contains sweetening sugars and also saturated fats all increase one's risk of developing type 2 diabetes mellitus. So why polyunsaturated or monounsaturated fatty acid reduces the chances of developing diabetes mellitus? The main causes of type 2 diabetes mellitus is as a result of defective insulin receptor. The particular insulin our body is producing has a receptor that recognizes it and allows it to function. But when this insulin receptor is defective, like when it is damaged, it will not be able to perform this function, and as a result of that, diabetes type 2 will occur. And the cause of the insulin receptor defectiveness is not known. So this is how far we've been able to go as far as type 2 diabetes mellitus is concerned. Now we've been able to differentiate between type 1, that in type 1, the insulin level is low or absent. So that is why the body will not use enough carbohydrate or sugar, and there is excess of this sugar in the blood. But in case of type 2 diabetes mellitus, there is insulin which may be low, which may be normal, or which may be above the normal value. But the problem is the receptor that ought to bind with this insulin is defective and it cannot perform the function. So, and that is why they call type 2 diabetes mellitus as sufferness in the midst of excess. So you are having excess body sugar, you are having excess blood sugar, you are having excess insulin, but at the same time the body cannot use the blood sugar. So in our next video, we'll be talking about gestational diabetes mellitus. Then we'll be talking about prevention and management of this condition. We do hope you've learned one or two things from this video. We want you to subscribe to our channel, share the video, like it, and don't forget to let us have your feedback in the comment section. Thank you for staying with us. Bye for now.